Good morning, Ceann Comhairle, and I want to thank the Ceann Comhairle for allowing me to take this issue to the Dáil at the 11th hour, and the reason he did so was because it's very, very time sensitive. First of all, I want to read from the HSE's health advice on its website in relation to cataract care. A cataract will continue to develop, and the only way to restore vision is by having surgery to remove the cataract. Cataract surgery is one of the most common and quickest forms of surgery. According to Ireland's Association of Optometrists, at the end of 2017, 40,000 people were on the outpatient list waiting for that surgery. Their stats show that the problem has worsened since, with an increase on the waiting list by 21%. The largest proportion of the waiting list for eye surgeries for cataracts, with 8,500 people waiting at the end of 2017, and some people waiting up to 4 years in parts of the country. Now, I want to talk about a man in my area. He's housed by the council in a pretty nice apartment, but he's a poor man. He lives on carer's allowance. His wife has MS and he cares for her, and she's on disability. Patrick Foley is 42 years of age and carer to his wife Carmel. He's 3 years now on the waiting list for cataract surgery and suffering blinding headaches while he waits this surgery, and he is literally starting to go blind. His eyesight is deteriorating more rapidly more recently, and his GP has written several referral letters to the Eye and Ear. He was advised to look at cross-border healthcare scheme, and to do this, he needs first of all to get someone to care for his wife, but because his eyesight is so bad, he'll do anything to get the surgery at this stage. Because he's on carer's allowance and she's on disability, they don't have the financial means to either save up or bring the money forward or go to a credit union for a loan. My office has asked continually the HSE to make an exception of this case where he cannot get the funding up front, and to make allowances for this, and their answer is no. However, considering that he is a carer and the length of time he is on the list and may go blind and his wife may end up in care, the state is actually cutting off their nose despite their face by not paying up front for Patrick to have this cross-border treatment, or preferably to have the treatment done here. People who can afford to pay wait 3 months. People like Patrick wait 3 years. The Department of Social Protection told Patrick that the emergency needs payment will not cover him, where the responsibility lies with another department, and that department is the HSE. And again, I wrote to the HSE highlighting Patrick's case and the urgency of it, and to date I've no reply back. He is going to go unnecessarily blind, and he is suffering terribly in the meantime. And this is because of our failed healthcare system. If he had money, he'd be sorted, but because he's poor and doesn't have the money, he is unnecessarily suffering, and as I repeat, will go blind. And that's why we needed to bring this urgently to the attention of you, Minister, so that Patrick will end up having his needs met. And I don't think that, judging by the state of our home health care or anything else, that his wife's needs will be met urgently either. I'll come back to some of the more general points on this, but I suppose one of the startling things to say about it is that the National Council of the Blind have been pushing really hard for the state to invest more in this. Now, there has been some extra funding given in 2018 to the National Treatment Purchase Fund, but it doesn't cater for people who cannot pay up front. And I am quite sure that Patrick Foley is not alone. But what I do know, and I've witnessed it myself personally, I don't know if you've come across him because you're also a local TD in the same constituency, but I have witnessed myself personally how rapidly this man's eyesight is disappearing and how desperately his life is actually plummeting ahead of him. So we need to do something, and we need to find a way for some department to pay for Patrick's treatment up front to allow him to live a life with his eyesight in full tact.
Minister Byrne.
Thanks, Mr. Comhairle, and on behalf of the Minister, I will be taking this topical issue this afternoon, and to thank Deputy Smith. Improving the waiting times for hospital procures is a key commitment to the programme for government, and there is a number of waiting list initiatives currently underway to improve access this year. In particular, in reference to the inpatients and daycare cases action plan, which was launched in April 2018, and the allocation of 50 million to the National Treatment Purchase Fund in the budget 2018 to secure treatment for patients and reduced waiting times. The action plan targets a reduction in the waiting list for inpatients and daycare treatment to below 70,000 by the end of 2018. Under the NTPF will deliver additional to the health system with the provision of 22,000 inpatient daycare treatments, which includes 5,000 cataract procedures and 1,200 tonsillectomies. The action plan has delivered to ensure an appropriate balance between high-valence activities and offering treatment to complex, long-waiting patients, as well as maximising the number of patients treated in both public and private capacity. Over the past year, the Department of Health has worked with the HSE and the NTPF to identify sustainable initiatives to improve waiting times. Last year, funding was allocated to provide additional capacity at the Royal Victoria Eye and Ear Hospital, which has augmented capacity to increase clinical focus on paediatric and adult ENT procedures.
Just repeat that what the HSE website says. Cataract surgery is one of the most common and quickest forms of surgery and will help to save sight. The National Council of the Blind have said that waiting lists are out of control, and that's much more shocking when you consider that 75% of sight loss is avoidable. Now, they've called on the Minister for Health to publish the implementation of the primary eye care services report, which was expected in the summer of 2015 and still hasn't been published. And your answer, Minister, with all due respects, and I know you wouldn't know the detail of the personal case I was bringing before you, but nothing in that shows us that there's any consideration given to those who cannot afford to pay up front for the National Treatment Purchase Fund. Social Protection won't pay it, the HSE won't answer, and then meanwhile this man, who is a carer for his wife, is literally going blind. And if I have one example of it, a man in your constituency, Minister, there are others out there. There have to be dozens of others out there. The National Council of the Blind and Mr Keegan, a consultant ophthalmic surgeon, have been campaigning for this National Vision Strategy for the last 6 years. And Mr Keegan has warned us that we have a national scandal on our hands. Medics have also warned that the long waiting lists are particularly harsh on patients whose deteriorating sight could be reversed. And that is the case for Patrick Foley. His problem is he's poor. He doesn't have the money to pay up front for the surgery, and everybody, no matter what department we turn to, everybody is ignoring him as if he wasn't a human being, and indeed his wife, whom he looks after. And this is shocking. In the 21st century, in the fastest growing economy in Europe, I recognise that the National Treatment Purchase Fund is trying to deal with the backlog, but there are some people who fall through the cracks. And they are the people who are the most vulnerable, the weakest and the least represented. And I'm asking you to intervene on behalf of your constituent to ensure that Patrick Foley gets the National Treatment Purchase Fund, or preferably the eye surgery that's needed in this state, before the man literally goes blind.
Minister Byrne. I assure the Deputy the engagement between the Royal Victoria Eye and Ear Hospital and the NTPF provide a very clear example of positive impacts. Such collaboration can only have a real effect on waiting lists and ultimately to benefit all of the patients that are receiving their treatment. However, in light of the particular case which you've spoken about, if you want to give me the details, Breed, I certainly will forward them and bring them to Minister Harris' attention. If you want to pass them on to me and see what can be done in that case. There was 37,863 people who attended the eye and ear and the outpatients attendance list, and out of that 3,494 patients didn't show up for appointments, and that just shows how difficult it is sometimes to reach patients out there and get them in for appointments. But I think it's a clear indication that we do have high numbers, and there's nobody disagreeing with you on that. But just to read something here which I've just got handed in the last few minutes, is that last year there was 34 patients in the eye and ear waiting between 24 to 36 months, and that's down to 5 this year. That's the latest figures. And those people waiting, there was 290 patients waiting last year from 18 months to 24 months, and that's down. The latest figures is down to 9 patients. I will bring all your concerns back to the Minister, and I can assure you, Deputy Smith, that I, like you, who represent the same constituency, are very concerned with the amount of people that come to our clinics who have difficulty in having what we would regard probably now in surgery as probably simpler surgery than it used to be in the past, having cataracts removed. And I certainly will bring your concerns to the attention of the Minister, which I've taken down. And again, if you would like to forward me on this man. I didn't get a second name. Patrick Foley.
Minister, it's time sensitive, that's why
Am I good?
Yeah.
I don't want him to go blind on his
Okay,
Yeah, well, if you pass me on the information, I'll certainly raise it with Minister Harris.
Deputy
Thanks.
Sean, Minister, you taking the